Hello, and welcome to the Medical Fitness Podcast. I'm David Flench, President and CEO of the Medical Fitness Association.
And I am Jeff Young, co-founder of the Medicine Rehab and Fitness Institute. Today, we're joined by Dr. Andrew Mock, a leader in lifestyle medicine and medical fitness. Dr. Mock is presenting a keynote at the upcoming Medical Fitness Association annual conference in San Diego, where he will be exploring how lifestyle medicine's 6 essential pillars, which are nutrition, exercise, sleep, stress management, social connections, and avoidance of risky substances, connect with medical fitness to create sustainable health improvements.
Yeah, and Dr. Mock is the chair of the Fitness and Medicine Member Interest Group for the American College of Lifestyle Medicine. In addition to that, he's also a member of the Board of Directors for the Medical Fitness Association and is the chair for the new MFA Physician Advisory Committee. So we're thrilled to have him here today to talk about his work, his passions, and what's ahead for the medical fitness industry.
Hey, Dr. Mott, how's it going?
Hey, Jeff. Hey, David. Thank you guys for having me. Always great to have a conversation about medical fitness and really how lifestyle medicine is being delivered in a medical fitness setting.
Absolutely. I'm excited to get started. So let me start off with the first question. You have obviously had an impressive journey in both lifestyle medicine and medical fitness. What first drew you into this space, and how has your perspective evolved over the years?
Yeah, so Jeff, I think I said the last time I was on the podcast, I actually dropped out of high school. And part of that was because of some health conditions that made me miss a whole lot of school. And it was finding the gym for myself that really gave me some guidance. Back then, I thought I was going to be a bodybuilder. Ever since Arnold, there haven't been very many tall bodybuilders. So that dream quickly died when my legs didn't grow like the shorter guys. But yeah, I love learning about exercise, and I love learning it about anatomy. And then I found out even more, I love teaching it. So I always just had this idea that I'm going to into medicine to be a teacher. And when I first went into medical school, it was actually I remember where I was standing on the lawn of our medical school when I was thinking, like, man, it would be so cool if we had this combined gym clinic space where instead of patients going to the hospital when they're sick, we went to the patients where they're taking care of their health. And ever since then, that's really kind of shifted things into my brain of like, how are we delivering this healthcare and coming to the place where patients are taking care of their health? And that was before I even knew anything about medical fitness. And so finding out about medical fitness after that was a duh kind of moment. It's like so glad that other people are thinking about this and it's not just some crazy idea flipping around in this head.
Andrew, I know you are getting ready to give one of our keynote presentations at the annual conference for Medical Fitness Association. We're really excited to have you there, and from what I saw so far, the presentation focuses on the 6 pillars of lifestyle medicine and how that relates to medical fitness, which there's obviously a huge overlap. And of those 6, do you think any of them, and if so, which are the most underutilized or maybe misunderstood in a medical fitness setting today?
Yeah, normally my answer to that question on any other podcast would definitely be lifting weights, but thankfully in good company here, so we don't have to beat the exercise one. Yeah, I think nutrition and exercise they get covered relatively well. Even if your program doesn't have it, I feel like most people are assessing and addressing some aspect of those. Probably the one that has the ability to make the biggest impact when it's there is going to be the substances part of it. And I know that that probably doesn't feel like a medical fitness space, but at least talking about substances and then connecting them with appropriate referrals for that could be an important role that medical fitness plays. But I do think the two that are not typically addressed that are a very important part about medical fitness is going to be the sleep and the connection piece of that, right? I think we can start with connection. That's the whole reason gyms exist, is everybody's coming together in the same space. So I think that is something that we do well in medical fitness already. And the result of that is when people complete a medical fitness program, what happens? They don't typically leave your facility. They're far more likely to stay. But those aside, man, sleep is such an under addressed one. And it is the one that will kill you the fastest, right? Because most fatal car accidents are associated with inadequate sleep. So, and if you're a business, you should definitely care about your employees' sleep. I think in the US, it's something like 420 billion with a B dollars annually from inadequate sleep, because you're tired people, they don't come in to work. When they do come into work, they're less likely to do the hard work. They'll choose an easier task. And then that worst case scenario is they never come back to work again from that car accident. So this is why places like Google and some of the Silicon Valley people, they have sleep pods at their work. So I don't know how that looks from a medical fitness standpoint, but certainly assessing people coming into your programs and seeing where they are in that sleep pillar, and then providing some general counseling. We do know that if we provide the counseling, it can significantly improve things. Telling people they should be getting a certain amount, making them see where they are, we do know that that significantly changes our sleep and the amount that we get.
Let me chime in here real quick. Would you agree that that's something that kind of tying this? I'm trying to bridge this gap between sleep and medical fitness, or even just fitness. That's something that we could track, right, with wearables. So we could track it with wearables, get your what your initial baseline is with how much like REM you're getting and stuff like that. So now you have your baseline, and then maybe track how your progressive medical fitness program is hopefully then improving that, and hopefully with the other pillars as well, nutrition, good nutrition, stuff like that. But obviously, I agree with you. It's so important, and also I would include. I know I'm kind of rambling on here for a second, but recovery too, because when we think about lifestyle medicine, the umbrella is sleep. But if the person is on a properly designed progressive exercise program, and also includes resistance training, then I would at least under the umbrella of sleep include recovery as well. So I'm kind of asking you a dual question, but I do think that we can really bridge those two things because we can track it. We can track the improvements via lifestyle medicine. And then I think that we also should be tracking, or at least acknowledging the importance of recovery from a progressive exercise program.
No, absolutely. And definitely outside of nutrition, I would argue sleep is even more important than nutrition, so long as you're doing something on the nutrition side of things
Yeah.
for that recovery aspect. Um, if you pick any given fitness outcome, right, and then give somebody inadequate sleep, and it will get worse, right?
That's right.
All that muscle you're trying to build, you're not going to build as much if you're getting inadequate sleep. If you're trying to get stronger, you may have great days. I remember, I think actually the first time I pulled 650 on for a deadlift, it was after a 24-hour call, and you're like, "What in the world? How did that even happen?" So, sure, one bad night of sleep. You could argue that I had already been able to pull 650, and if I was well rested, I probably could have pulled more. But still, the reality is it just influences so much. So definitely the technology is getting better and better. The integration of that technology and how easy it is to pull that data in is getting better and better. But what I will say about the sleep wearables, I don't have my watch on, but I also have a ring. Maybe I shouldn't mention the brand, but probably a popular ring that people are aware of. um, it's pretty good at telling you number of hours. And we're saying compared to what? And that's a true sleep study in the lab. It's pretty good at telling those hours. As far as the stages of sleep, it could be better. So
Okay.
it's mixed evidence, but apparently this ring is currently the best on the market in terms of giving those accurate numbers. What I will say though is if it gives you a readiness score, or some sort of recovery score, I will say I don't know if we know what to do with that just yet. because there is some error in those scores. And what we do know is if that score tells you that you're going to have a bad day, I can actually program it to lie to you and tell you that you're going to have a bad day. Even if you thought you were going to have a good day, you will then have a bad day.
Yeah, the nocebo effect, right?
Yeah, absolutely. So that would be my only caution on the wearable side of things is we just haven't gotten there yet from that score. That being said, I had a viral illness a couple weeks back, and my ring definitely picked up the heart rate variability change, right? And it knew that day that I was starting to feel sick. So the data's there. It just hasn't gotten as clean yet to be able to use it. But I mean, yeah, spot on with the programming side of thing. If your sleep is not doing great, it's going to be so hard to progress long term, and your risk of injury is going to go up so much. So you'll notice that if you're using like an auto regulatory program to back off on your intensity on those worst days, you're probably going to have more worse days if you're sleeping poorly.
Yeah.
You know, I didn't realize this was going so deep into the sleep, but this is great because I mean, as you mentioned, it's underutilized, and I mean, you also brought up risky substances. I think those two, yeah, you can talk about those two together quite well. Also, right? I mean, what are your thoughts on that?
Yeah, absolutely. So up until I think it was the 2018 publication for the State of US Health, tobacco was the number one risk factor for all cause mortality. And you say up until 2018. Now nutrition is the number one risk factor, but tobacco is still number two. And vaping has become one of the larger ways that people are taking in nicotine. So it's certainly shifting, but those substances absolutely impact all of the things that we're talking about. It's one of the number one low hanging fruits that you can do if somebody is smoking to help them reduce that and eventually quit. The same goes for alcohol. Both of these are stresses that don't provide some productive adaptation after you take them. Well, I guess your body does get better at metabolizing alcohol, but certainly is protective in that moment, but doesn't prevent the long-term complications for things. So both alcohol, tobacco, those are both very much substances where zero is better than some amount in those cases. And we see that actually, I think it was January of this year, 2025, Surgeon General put out there is no safe amount of alcohol when you're talking about certain types of cancer risk. So
Wow.
for all people, right, you can decide where that line is. It's a legal substance. But if you wanted to minimize the risk, I would say not doing it outside of those times that are really important to you.
This is interesting stuff and good points that you're bringing up. And it actually leads perfectly into my next question. Since we're talking about lifestyle medicine and the pillars, what are some practical methods medical fitness professionals can use to assess these six lifestyle pillars in their members or their patients?
Yeah. So American College of Lifestyle Medicine does have a pillar screener. This was actually adapted from Loma Linda University's short form, Lifestyle Medicine short form. So you can find those both online for free. But what I will say is if you do not ask about it, you don't know what they're doing and you cannot change anything. So make sure that you are asking something. Um, while nutrition is probably more complicated, exercise, certainly on the resistance training side of things, more complicated to really know what someone is doing. For a lot of the other pillars, you can ask some simple single item questions, maybe one or two items. I think like sleep, you could say how many hours do you typically get in a 24-hour period. Have them write that down. And then a simple kind of quality assessment would be, do you feel rested throughout the day? Or do you ever have to take naps? Those types of questions. On the substance side of things, you can use, I think it's the TAPS 2 if you want a validated questionnaire, which is in the last month, how much have you used? And then the second part of that would go into more detail for those questionnaires. Um, connection, it used to be that we said it was only social connection, but I like to kind of just make it more broad and say connection as a whole. So what does that mean? To me, that means it can be a higher power or purpose. It can be the world around you. So that can be nature. It can be your community, right? Which can be the broader community or your nuclear family. And then also connecting with yourself. So I really like the simple question is what gives you purpose or meaning? And it really takes it quite deep very fast by asking that question. But we actually had a famous doctor at Loma Linda. His name is Will Alexander. He actually passed away the year before I started at Loma Linda. And his famous question was, what are you famous for? Especially if you're a clinician, taking just a few minutes of the conversation to ask that question can be huge, right? This person may be super stressed out. They just got hit with all these medical diagnoses, and you just took a step back and got to know the person beyond the health condition. So if you want people to come back to your facility, how are you connecting with them as an individual? And then how are they connecting with your facility, the groups within the facility, and other members within that facility? I think those are very important questions to think about.
Absolutely. And you definitely got philosophical there, and that seriously, you got philosophical. And I don't know that we have the time to dive into this, but it definitely opens up cans of worms by asking those questions. You're actually reminding me that, right or wrong, I do scroll TikTok, and I'll see this stuff come up on TikTok, where people are just lost with what life is, and what am I doing here? And all I do is work, 50 hours a week and pay the bills, and that's all I do year round. And it definitely can get philosophical. And then from your standpoint, a physician standpoint, how do you even address that? That would take a skill set in and of itself, right?
Yeah. And so, I mean, I think this is definitely a skill. I mean, whether you're a clinician or a qualified exercise professional or just a person, understanding someone's why is so essential for behavior change. Because and I think that was addressed in one of the more recent episodes, right? About what actually promotes behavior change. Because if you're doing it just for the long-term health benefits, science is not very good on that being a reason for behavior change. But if you said, hey man, I'm feeling stronger, and guess what? I can there's like this UK advertisement about this older guy, he's doing kettlebell training, right? And you see him doing it and everybody's just like staring at him. Why is he doing this for months? And then it flips to the Christmas scene and he picks up his granddaughter,
Oh
right?
yeah, I've
And they
seen
put
that.
the star on the top of the tree. So,
Yes.
that short-term benefit of that why is so huge. So, I mean, yeah, I'd say if you're a qualified exercise professional, you got to think about how you're connecting with the person you're working with as well.
Yeah. Great points. It's going to lead to the next question, a little unrelated, but what role do you see exercise professionals playing in bridging the gap between clinical medicine, your world, and everyday wellness?
Yeah, this is an interesting one, right? Because our medical system exists with physicians as the gatekeeper for a whole lot of things. And as a physician, I don't like that because the reality is when we're talking about those lifestyle pillars, I think a lot of those should be common knowledge and skills that people can work on. So I would love it if there's a way for people to get access to those services across nutrition, exercise, and all the other pillars without even having to talk to me. Um, because, yeah, it takes a while to get into our office and have that conversation. So, and of course, we run into some interesting conversations about like what's legal in any given state for someone to talk about based off their credentials. So, I don't know the answers on that legal side of things and where the line gets drawn. But the truth is, I think people are going to be getting information from somewhere.
Yep.
Um, and we all know the challenge right now is the ease of access to low quality information.
Yep.
So, yeah, anyone that you're working with, I think we all have an obligation right? An ethical obligation to be providing that high quality information, because the default right now is there's low quality information that is harmful. That's one tap away or one scroll away. And the volume of that is very high. So yeah, I mean, I would say this goes for doctors, this goes for qualified exercise professionals. Probably it's better with exercise professionals, but 1% of doctors are active on social media.
Wow. 1%?
1%.
Wow.
So think about all of the information that's not coming from what I guess used to be one of the more trusted medical
Yeah.
professionals out there, right? So it's challenging, but yeah, I think another part of it too is um, I think the exercise professional can play a major role in making sure people are connected with the system, right? So if you're seeing something concerning, say, hey, you should definitely talk to your doctor about that, and connecting them back to that source of care, I think is a very important part of the role that they can be playing. And that's built in right into the PAR-Q, right? That's what it's meant to do. For those that are low risk, great, everybody can do this. But for those that need additional supervision, let's make that connection back to the person who can provide the correct treatment.
Absolutely. And I do have one other question. It actually kind of loops back around to what we were talking about just prior to the question I just asked you, which related a little bit more to behavior change. Many people struggle with sustaining lifestyle changes. What strategies do you find that are most effective for building long-term habits in your patients?
Yeah. Jeff, you might be able to tell me this one, but I'm blanking on what the actual concept is called. But it's behavior is a formula where you have your motivation, your ability to do it, and then you can multiply that by some sort of prompt to increase your chances for success. So long as you have some sort of motivation, some sort of ability to accomplish it, you can use that prompt to then trigger the change. A great example of a prompt that I use in every day in practice. So for my patients with osteoporosis, their prompt is when they walk through their doorway, right? They don't want to bring dirt into their house, right? They want to knock all that dirt off their feet. So they're going to stomp hard 5 times each foot every time that they walk inside their door, right? And that's just trying to get them to do some of that initial impact training and create that prompt to increase the success of the behavior. Um, so that's a way to attach it to something that you're doing already. And I really like to leverage kind of what we call that habit stacking. So if there's something that you do really well already, can we attach the behavior that you want to change to that? Right. So the classic example would be I'm bad at flossing my teeth. So I'm good at brushing them. Can I attach the flossing to the
Yeah,
brushing? Or, right, every day after I come in from walking my dog, because we do that walk every single morning, what's that new behavior that you want to add right after you get done walking your dog?
love it.
So that would be one. I think, especially in the initial period, some sort of self monitoring. And you can go way overboard with self monitoring, and that can become a hindrance. So, have someone who is not currently tracking any aspect of their nutrition download some app to then scan in every single barcode, right? Every single day, multiple times per day. That is not going to last for a very long time. So you're asking for failure in that sense. Instead of having a outcome oriented goal that you're tracking, like number of calories total per day, can we track a process, something that you know that will lead to that, right? In this case, thinking about like, well, vegetables and fruits are less calorically dense. They are going to be a process oriented goal that leads to that outcome automatically. And they're also easier to track, right, than every single detail for things. But flipping it back to the fitness side, hey, if you want to finally hit 315 on the bench, guess what you need to do? You need to stick to your programming and not skip training. So
Yep.
can you track the number of days that you went to the gym and completed all of your training? Or even step further, right? Can you just track that you went to the gym on those days? So yeah, some sort of self-monitoring and specifically shifting that to a process-oriented goal rather than an outcome-oriented goal. I find it to be incredibly helpful.
The Medical Fitness Podcast is brought to you in part by the Medical Fitness Association. Attention medical fitness professionals, the event of the year is almost here. Join us for the MFA Annual Conference, November 4 through 7 in San Diego. Network with industry experts, connect with peers from across the US and Canada, and gain insights from some of the leading voices in medical fitness. This is your chance to get inspired, level up your career, and bring new ideas back to your facility. Don't miss it. Mark your calendar for November 4 through 7 and register today at medicalfitness.org. That's medicalfitness.org.
Great stuff. I want to shift gears a little bit. You have emphasized the importance of strategic partnerships between medical fitness professionals and lifestyle medicine clinicians. What do you feel like an ideal partnership should look like in practice?
Yeah. So, I mean, it goes back to that connection, right? And what it looks like. In a perfect world, I can put my arm around him, right? And say, hey, I really need you to talk with this person. And I'm doing that warm handoff. So that's the whole idea of we're all in the same space, and that happens to be the medical fitness facility. So I think that's the most ideal situation is everybody's right there, and you're not having to rely on some sort of technology to communicate. But probably more practical would be that whatever it looks like to have that two-way communication. Right now, I try to treat them just like any other medical professional. Since I don't have a way to get them on the electronic health record and send messages back and forth, there has to be some level of patient consent. So getting the patient to say it's okay for me to reach out to them about information. Um, and then I make sure that I give the fitness professional's name, just like I would when I was referring to a cardiologist, right? And I say, hey, you're very interested in women's strength training. Great. Ashley Scott, she runs a women's strength training program in the area. Would it be okay if I send that connecting message between you two for that? And so I can use Doximity with my spoofed number where they cannot reply to my personal cell phone to connect the two numbers and give that warm handoff in that way that the patient approved to do so. The challenge is in getting that information back. So it's probably easiest if you are going to the place where that fitness professional is because you're able to have those increased chance encounters with them to exchange that information, but not always practical. But I think having those regular check-ins with them and seeing, what could be better about the referral process and that kind of quality improvement approach is helpful.
Yeah, I love that. I also know that a lot of medical fitness centers struggle with connecting to physicians. Even hospital-based facilities sometimes have that challenge. They come to me and at MFA and ask, what can we do to, search for or find a medical director. We want to be certified. We want to have a medical advisory committee. But right now we don't know where to start. And so, do you have any advice on to give to medical fitness centers that want to strengthen their relationships with physicians and other healthcare providers in their communities?
Yeah, I mean, I think it's a similar part of the same problem is how do we identify the not the qualified exercise professional, but the qualified medical professional? Because I mean, it's a harsh truth that on average, doctors get very little education around exercise. So we need to make sure that it's someone who really gives the value to exercise interventions for management of chronic health conditions. So if I was trying to give very broad general advice for this, I would say, who do you know? And who does who you know that they trust? That's a fair general rule to start. So I think any of the three members on this current podcast could tell you who they know in any given area, and maybe connect you with someone as a place to start. If we're going for more formal frameworks, right, looking for someone who has a combination of things, both a academic background with a dedicated interest in this area. So some sort of certification, whether that's American College of Sports Medicine, now American College of Lifestyle Medicine, where we're working quite hard to make sure physicians are trained on conditioning and strengthening programming. Um, and then I would look for experience, because if they're not exercising themselves, or right, don't have experience exercising themselves, then they're going to likely place less priority on those interventions. So yeah, and at the very least, if you have those physician athletes in your area, they may be a great place to start and tell you somebody that they know that really cares about it. Yeah, they might already be seeing them from a sports medicine side of things, keeping them active for their triathlons. So I wish I had a better answer than that. Hopefully, as our lifestyle medicine network grows, you already can look online to identify board certified lifestyle medicine physicians. I will tell you, I have growing confidence that they will be individuals who can have those better conversations around exercise interventions. But even amongst the specialty that should know more, we're still looking for those improvements. But let's see. Um, Other specialties, of course, orthopedic sports medicine, primary care sports medicine, and physical medicine and rehabilitation. Those would all be some of my first looks for people who might be interested in what we're talking about.
I have a question for you. It's a little bit of an odd question, but it's an honest question. Yeah, we're talking about a vet. Well, we're kind of talking about a vetting process, right? But vetting, but kind of bypassing it a little bit. If I'm understanding correctly, kind of bypassing it a little bit because you're just trying to connect networks and stuff like that. But I'm also wondering from, your standpoint and just your honest opinion, what about like an intake form or something like that? Because when I think about for example, in the situation I'm in with the Medicine Rehab Fitness Institute and wanting to bring on more exercise specialists. And I could just say, hey, so and so, one of them that's already working with me, who do you know that you would recommend? But I want to tighten my ship a little bit and make sure that it goes a little bit beyond that and that there really is an interview process. But this isn't a situation where we can actually sit down and interview and say, hey, we would like you, physician so and so to be part of our advisory board, but you need to sit down for an interview, and so we can make sure that you're credentialed and competent. But maybe we could bridge that gap through like an intake form. In other words, is there a way to somehow bridge that gap without being so formal and really probably offensive by doing an interview? Something that's in between the formal interview that's going to turn them off, but maybe a little bit better than, hey, do you know somebody who might be interested?
Yeah, I mean, the thing that came to my mind is invite them to the gym to come work out with you.
Yeah.
What's the worst case that happens there? If they're not active, you just helped address their inactivity, right? And can have that time to build the rapport and increase, right, their motivation to engage in the activity that's going to help their personal health. So it might be, right, reach out to doctors and offer them your services, right? Them as the client, them as the patient. Because, yeah, statistically speaking, we're just as unlikely to be meeting physical activity guidelines as others. So, yeah, that's the worst case scenario. They get stronger, they get more fit,
Yeah.
and you might have created a new ally in that fashion. But yeah, that also opens the door once you have that rapport to say, who do you know in this space that you would recommend?
Yeah. Good advice. I'm going to shift gears here a little bit and under the umbrella of policy and advocacy. I've known you for several years now, and the more I get to know you, the more I realize that you're somehow involved with nearly every organization on this planet. And it includes the Medical Fitness Association and the Physical Activity Alliance. So you've been active with the Medical Fitness Association's Physician Advisory Committee And you recently worked with the Physical Activity Alliance on coverage determination for exercise professionals, which is a hot topic. Why is this advocacy so important right now?
We have to get paid. That's the bottom line for things, right? If you want behavior to change, tie it to reimbursement. As much as I love what I do, and I'll just share openly. So I own my own gym. My gym operates at 0 to net negative cost on paper. But that's because that's what I want to do. I'm trying to reduce my taxable income as a physician with that harsh tax bracket that I move into, and then just grow my community, because that's what I love about my sport is the community, my own connection, right, to everyone there. But not everybody has that luxury of my physician income that supports all of that. So at the end of the day, other people need to pay the bills. And we want to get reimbursed for those services. So sure, can you get your FSA or HSA account to pay for an exercise service for the treatment of a medical condition? Yeah, we can write that letter right now. We just have to be careful and follow the rules, because the IRS is not somebody that we want to make mad. And they're the ones who kind of oversee, right, what's covered for FSA and HSA purposes. I think it was actually a great podcast going through all of that. I think it was the PAA group that went through all those details. So if you're interested in that space, go listen to that. If you're just here for, exercise information, you'll be very bored listening to that conversation, because we're talking about like rules that Congress makes. And that is what determines what gets paid for from a medical side of things. So we recently had that conversation with Center for Medicare Services to talk about what we call the physician fee schedule, which is basically what are we going to pay for and how much are we going to pay for it. And the way that medicine exists right now is oftentimes we're into two main categories. They're the prevention things, and then they're kind of the treatment or the illness script side of things. And that's the conversation we're having with exercise right now. So if you go to physical therapy because you have back pain, I can give you that treatment script, and that's covered under therapeutic exercise with an order from your doctor. But if I want to prevent that back pain, there's not really anything that exists to cover that. And the other question would then be, do you even need to go to your doctor, right, to get that script? So how could this community-based organization or a medical fitness facility get reimbursed for that prevention piece with or without the clinician being involved? So I guess we'll just see how it goes. I think this is one of the opportunities with our current administration and our current director of Health and Human Services. So with RFK, I mean, I think I saw just a couple weeks ago he was doing pull-ups in a CrossFit gym. So we need to work on the areas that we align with, and just see what's possible for things. But yeah, as far as the coverage determination, it's complicated. But certainly, if we change that coverage determination so that the reimbursement is there, behavior will follow the dollar signs.
Do you have a sense of the timeline? Let me throw it within the next 5 years or more than 5 years.
Yeah, so I think there are things we can do right now, and we can thoughtfully game the system to get exercise services covered. And that's under that illness script way of doing it. But even as soon as the 2026 physician fee schedule, we can see changes that will drastically improve things. So
Wow.
these things are reviewed every single year.
Okay.
And then we can write new rules, which is probably the easier way of doing things. So don't want to get too much into the lingo because I'll show just how ignorant of the process I am. But yeah, so there's this national coverage determination, which says what's covered under the Congress letter of the law. And then there's the rules. So it's hard to change the national coverage determination because it takes a literal act of Congress. but we can mess with the rules side of
Okay.
things. So one of the rules that's being discussed is, could we expand programs like the diabetes prevention program or intensive cardiac rehab to include additional conditions covered? And just to think about that for a second, so many of you might have, right, intensive cardiac rehab program that you run. Think about what would happen to your program if they, for example, changed a rule to have obesity be a covered diagnosis under that intervention. We would be really struggling to think about how we're going to expand our intensive cardiac rehab programs to include 75% of the population.
Right. Absolutely.
So that's what's possible. Of course, we need data to make all of these changes. When it comes to exercise, we're very bad at doing exercise research, partially because we don't record what the actual dose is very well. So that's a whole
Yeah.
conversation in itself. Something I know that Jeff and I think about quite a lot. And actually, part of the conversation with our workshop for American College of Lifestyle Medicine is just making sure the doctors understand how to get the appropriate dose for things.
Yeah.
But yeah, I don't pretend to know all the things, but yeah, politics was never the area that I wanted to go down, but realizing that that's the avenue that I can make the most change, it's been a very interesting process.
And actually, on that note, you shared something on LinkedIn recently that I wasn't aware of. That, man, that was so helpful. The consensus on exercise reporting template, CERT. And you shared that in a short discussion on LinkedIn on this topic, and I was so glad to see that paper. But yeah, it's exactly right. We just aren't in research and just in reporting. We just aren't covering the things that need and addressing and what's the word I'm looking for? Basically, we're not reporting on what we should be reporting, including things like dosing.
Yeah, and it's such an interesting problem because if you go into the CERT, um, and you go, I think I want to say it's like number 13.
Yeah, it
Number
is.
13,
I remember you said that on LinkedIn, and it is right around there. It's like 12 or 13.
and it's everything hinges on that one paragraph
Yeah,
because it's talking about how are you even knowing what you're doing, the type of exercise, the reps, the sets, the load, whether that's measured in absolute intensity or external intensity or some sort of internal intensity, whether that's rating of perceived exertion, some measure of velocity, whatever it is. And it's all in one sentence. And now take that to a medical team and a physical therapy team. We hope that they're writing down reps, sets, what weights used for each exercise. But where do they put that? In a free text box that takes AI to actually analyze that data,
yeah,
right? This is something that fitness is doing so much better than medicine already, right? Because I'm sure a lot of the people listening, right, they type into dedicated boxes for reps, sets, what weight was used or what
that's right.
intensity, like a 0 to 10 RPE.
Yep.
And it's how do we convince medicines to start tracking that way?
Yeah.
And until we do that, right, we won't even know the dose of what anyone's doing. So yeah, it's
And if I
very
remember,
interesting.
yeah, and if I remember correctly in that article, it also talked about like your decision tree and and that's something important too. What led you to make the decision on loading or progression and things like that. So yeah, we could probably dive deep into this for a long time, but yeah, there are the obvious point is that there are some really, really important
Mhm.
things that need to be reported that aren't being reported, and then it's not painting a nice clear picture that we actually really need to be painted.
Yeah. And I mean, it comes full circle. It ties back into something that I said already. You cannot change anything unless you know what someone is doing. So yeah, that accurate reporting of the exercise, the physical activity vital signs are not enough. If you're not using them, please use the physical activity vital signs. But when we're putting on that hat of they could be better, they're not enough to know what someone is doing.
Yeah. All right, let's keep moving. Next question. What progress do you see on the horizon for exercise programs being recognized and reimbursed within the healthcare system?
Yeah, we've had a lot of good data come out recently as far as helping with that progress for getting exercise interventions recognized. I mean, the return on investment information, I think that it was Physical Activity Alliance, American Heart Association recently came out with. So they kind of gave this list of certain health conditions, particularly some cancers, where for every dollar we spend on exercise interventions, we have a positive return on investment. So that's the type of information that Center for Medicare Services needs to be able to make these rule changes and say, yes, it makes sense for us to spend your tax dollars to pay for these types of things. And then when Medicare makes a change, everybody else follows suit. So hopefully, right, that information just continues to build and build. So it's the boring stuff. It's like looking at the claims data, looking at the long-term outcome information. That's what drives it. But not to beat the dead horse, if we're bad at studying the exercise, it's going to take even longer to get that information.
Yeah. I have one more question for you under the topic of policy and advocacy. Um, if policymakers were listening, what message would you want them to hear about the value of lifestyle medicine and medical fitness?
I think I'll treat them the same way that I treat my student doctors and colleagues. Engage in the pillars yourself, right? Take
Yes.
care of your own health. Even if that leads to no policy change, which I think is unlikely, right? At least our policymakers will be healthier, right? And from just a performance standpoint, they will be better at their job if their nutrition, their exercise, their sleep, their stress management, their connection, and their avoidance of risky substances is at a better place. So, yeah, as far as the work for the American Medical Association, my tagline now is like, physician health is patient health. So
Love
maybe
it.
congressperson health is patient health as well.
Yeah, love it. It does need to start there.
So Andrew, I mean, you're getting involved in so many different things. We just talked about policy and advocacy. Your lifestyle medicine clinic. You own your gym. You want to, make that even more of a medical fitness center. You work with ACLM. You've got all these things going on, and it's exciting, and it's really cool to be hearing about some of that involving you in some of the work that we do at MFA, et cetera, et cetera. We can go on and on about some of the things that you're getting into. I'm interested in hearing right now, looking ahead, what excites you the most about the next chapter of your work.
I think the most exciting thing is the opportunity with things, right? And the buzz around exercise. Um, as much as social media brings challenge, it also brings perspective. And, you know, uh, nothing excites me more than the amount of information that's now targeted at women around resistance training. And like seeing women now become the largest portion of the population in a fitness facility, right? And just how that is changing. So, and yeah, this is my preventive medicine hat and how my brain works from that bigger picture standpoint. That's huge because who controls a lot of the habits in the household? Mom. So if I
Okay.
target mom in the US, right, and mom is physically active, mom is engaging in nutrition services, mom is setting the bedtime so that everybody goes to sleep and gets adequate sleep, it's huge. So I think it's just we do have this opportunity with this current administration to really prioritize those pillars. And so the door is wide open for that. I'm just lucky. I'm lucky that my genetic gift is that I really enjoy exercising. Uh, and then I get to talk about it ad nauseum for other people every single day.
Yeah,
So yeah.
great stuff. Well, look, we have to wrap it up here, but first of all, thank you so much for joining us today. And uh, you're a multi-time return guest, and hopefully the listeners for today have been listening to all our podcasts and heard you speak before. But it's clear to us, it's clear to me, being a friend and a colleague, that your leadership in lifestyle medicine and medical fitness is making a real difference. And I look forward to seeing you hopefully on September 11th, right, at the PAA symposium. So I'm going to get to see you in a couple of weeks, and then we really look forward to your keynote at the MFA's annual conference in San Diego.
Yeah, and Andrew, for our listeners, if they'd like to connect with you, how best can they do that?
Yeah, finding me on LinkedIn, I think, is the easiest way. But keep an eye out. So we have our resistance training workshop that we're doing for American College of Lifestyle Medicine and our national conference in November. MFA, we have multiple sessions where we'll be talking about exercise interventions as well as lifestyle medicine as a whole. So would love to see you there. Obviously, I'll talk way more than time allows for all of these things. So if you want to connect, just reach out. Happy to have the conversation.
Well, it's great to have you on the podcast. Like Jeff said, I can't wait to connect with you in San Diego in November at the annual conference. Your keynote is going to be fantastic. I just know you've been speaking at so many MFA events, and each time I think it gets a little bit better. So I'm really looking forward to this one too. But
hey, and we'll be in my home state. So, well, not my home state. So everybody in Georgia is now offended. But
yeah.
We'll be in California, so that means I can bring some strongman equipment. So if you want to learn a little bit about strongman from current California strongest man, it'll be a fun time.
I love it.
We should have led with that on your intro, right? Sorry.
Yeah, we made a mistake on that one.
Okay.
All right. Hey, thanks again for tuning in to the Medical Fitness Podcast. And thanks so much, Andrew. Really appreciate it. And we will see you the next time.
Always a pleasure.
Thanks, Andrew.
This episode of the Medical Fitness Podcast is brought to you by the Medicine, Rehab, and Fitness Institute. The MRFI has been co-founded by medical, rehab, and fitness practitioners who see the medical necessity in getting people to be more active and fit. There is a sleeping giant of opportunity to building a more active population, an opportunity which lies in a more effective medical referral pathway to exercise programs and professionals equipped to serve that pathway. To learn more about our services and how we're working to make this a reality, visit mrfinstitute.org. That's mrfinstitute.org.